Welcome to this update. Now, at the end of the last video, we said we'd do a review of the situation in Iraq and South Africa. Not directly connected countries, but they've got a few things in common. And the main thing that struck me is when you look at the statistics on paper, they don't look too bad or on the websites. But then I've had reports from both countries indicating that health services are really struggling to cope with the number of patients, indicating that the number of patients in reality appears to be higher than the number of patients on the official websites. So let's look at those now. I think we'll start off with Iraq. Now, as we see in Iraq, the official figures are 48,000 cases, getting on for 2,000 deaths officially. And we need to remember, really, the population of Iraq is about 38 million people. And news reports show there's been an unprecedented rise in infections. Now, just before we go on, this is an Al Jazeera report. It's actually very hard to get information from Iraq. For example, I looked on the BBC website and they'd done nothing on Iraq for quite some days or weeks even that I found readily, and certainly nothing on the state of the pandemic in Iraq. So rather strange silence, really, considering how prominent Iraq has been in Western news reports over recent years. There now seems to be somewhat of a deafening silence. But Al Jazeera is saying unprecedented rise in infections, great rise in infections in Iraq. And doctors, according to Al Jazeera, warn that the healthcare system is close to collapse. 10 days after easing the curfew in Iraq, infections rising rapidly, more than 1,800 new cases recorded per day. Now, this does seem to be genuine, because just before we go on to the rest of this, I think I'll just show you this clip now. The concerns about the health services struggling to cope do seem to be genuine. I've come across this report, hospital runs out of oxygen. Now, this is so important because, as we know, a fair minority of patients, maybe 10% of patients, are quite ill with this, 5% are critical. And of that, between 5 and 10% of patients, some of them are going to need oxygen. Maybe not a lot of oxygen, maybe not for a long period of time. But that's going to be the factor that determines whether they live or die. So for a hospital to run out of oxygen, in the current situation, is about as bad as it gets. And it reports 4 deaths. So it's this hospital. As far as I know, this is in southern Iraq. And the doctors there have said, we can't watch our loved ones die because of mercenaries and those who make a business out of poor people's lives. So very strong language there. Now, I have seen the news conference that is in. But what I'm going to do now is just show you a video of people waiting for this oxygen to arrive, and when the oxygen does arrive, unloading it.
صاير فيه يلا لازم يسوون حل العالم، لازم. إذا ما يسوون حل العالم العالم تموت. يلا باعت تجمعات اللي موجودة على بطل أكسجين، اللي حصل بطل أكسجين تجي رحمة من الله، اللي هذا البوش مال أكسجين. ومن تطلع تتظاهر ضد مدير الصحة، ألف واحد وألف جواد يطلع لك وألف لوقي يقولك لا ما يصير، هذا شهادة مال الدكتوراه، يا دكتوراه يا نعال خربي وخرب شهادتي. اللي ما يحترم العالم واللي ما عنده إنسانية واللي ما يخدم العالم باوع. فين اللي قدام هناك هاي مرضى.
So you could see the replacement oxygen cylinders being delivered from the back of the truck as relatives and staff clamoured to get it. Now, that video was sent to me by a local resident from Iraq. And this is what the local resident says who sent me that video. Hope you are well. You have mentioned in many of your videos there should be great concern about poorer countries and their crippled healthcare systems in handling of this pandemic. Please see attached videos captured at the hospital in southern Iraq highlighting our concerns. Massive queues and fights for oxygen for ill family members, just general chaos. Currently there is a critical situation in some hospitals in southern Iraq, all lacking basic equipment and even PPE for that matter. The country has only been seeing around 2,000 new cases per day for the last week. The system is already overwhelmed, with doctors going on strike. This is inevitable considering there hasn't been significant investment in Iraq's healthcare system since 1980. It's clear that many people will needlessly die here in the coming months. Please feel free to share this information with the world. So obviously I can't reveal the name of that person, but I know who they are, and I do believe that to be a completely genuine email. And this is in the news report from the doctors. So what seems to be happening is there seems to be like a black market in oxygen, and there's profiteering going on. That's what seems to be happening. And 4 people have died in that documented case. So a lot of concerning things there. Now going back to the official data that we have here. Well, this is from Al Jazeera. Now, last Sunday, the 28th of June, again, this is according to another news outlet here, there was 1,749 new cases, roughly consistent with what that local resident said there, at about 2,000 new cases per day. Testing, they did 11,000 tests in 24 hours, and they've done over 500,000 tests now, so testing is stepping up there. Now, the World Health Organization seem to have realised there's a problem now after some months, and they've launched a major health awareness campaign. So, for example, I've heard that they're setting videos up in various public places and playing public information videos on how to slow down the transmission of COVID-19. And apparently in the southern Iraq, there's been new lockdowns in Basra province and Maysan. And of course, many people watching from the UK will remember this name with pain and discomfort. But now the people there seem to be really suffering through basic lack of healthcare provision. So what we have there is concerning accounts from 2 or 3 reputable news agencies and quite a lot of local news agents. A lot of local people sending me news personally. And I just feel considering the interest Western countries have taken in Iraq over the past few years, it just seems a pity that such basic needs as oxygen are not being met. So my email correspondent is concerned that due to the poor health provision, more people will die. People that could have been saved with basic health care are probably not going to make it in Iraq, and that is just one extra tragedy to add to the long list of tragedies already suffered by the people of Iraq, the ordinary, often fairly poor people in Iraq. Now, I'll just show you another graphic before we go on to South Africa. So here we have the increasing cases. New daily confirmed COVID cases in South Africa here. But of course, South Africa's got a larger population than Iraq. Iraq was 38 million and South Africa's got a population of 58 million. So very steep increase in new confirmed cases. Not quite what sure is happening in Iraq here. Let's hope this is a genuine levelling off, but I'm not actually convinced that it is. So what we're seeing is upward trends in both countries, I'm afraid. And deaths are also increasing. Now, this is the deaths in Iraq, and this is the deaths in South Africa. Now, obviously, this gives you the clue straight away that deaths are being underreported in South Africa. I mean, deaths are probably being underreported in Iraq. So if they're underreported in Iraq, it looks like they're even more underreported in the South Africa situation. But again, news from South Africa are actually quite difficult to get. The world seems to be distracted at the moment. But I have got some official reports from the South African government, and then I've got a report on the ground from people on the ground from a local news agency. And to be quite honest, the situation's no better than the one we've just seen in Iraq. But let's look at the official government information first from South Africa. Population 58 million. Official cases, official deaths. Now, this is plastered all over the government official website for COVID-19. President Cyril Ramaphosa, 23rd of March, about the same time the UK lockdown was instigated. 3-week national lockdown, severe restrictions on travel and movement. And this was a very complete, severe lockdown in the early stages. The president said more needs to be done to avoid an enormous catastrophe amongst the population. So, strong language here being used by President Ramaphosa. Sale of alcohol was banned. They seem to think that would be a problem in South Africa. Borders were closed and quarantine enforced on inbound travellers and returning citizens. All good, of course. Then, next update on the official website, the 1st of April, from the Minister of Health. That they are announcing on the official government website for COVID-19 in South Africa that they've launched at this time 60 new mobile testing laboratories, 10,000 community healthcare workers, door-to-door household screening. Now, the good thing about the people in South Africa, as in other cases, they are very skilled already, and there's a workforce already skilled at tracking down people with HIV. So this is a highly credible report, that we have people on the ground who are good at contact tracing. So good to see that is being done. And they're referring symptomatic people to clinics for testing. And they have the capacity to test 5,000 tests daily now, and that's increasing to 30,000. But of course, given that we're talking about a population of 58 million, that kind of puts that into a bit of context. I'm sure that's nowhere near where the South African government would like it to be. Now, this news report again comes from, as I've said, from a local news agency here in parts of South Africa. Patients are lying in the corridors of hospitals like Livingstone in Port Elizabeth and are dying. City Press report. So, again, it looks like what we've seen, very similar to what we've seen in Iraq. As soon as the lockdown was lifted, we were seeing rapid spread. And the lockdown in the UK has caused difficulties, of course, but the difference is the lockdown in South Africa was causing widespread hunger. People relied on that day's income for that day's food. So the lockdown was really unsustainable in the form that it was in South Africa. But once it was lifted, we saw rapid community spread, as indeed we anticipated a long time ago, unfortunately. Now, these patients in Livingstone, Port Elizabeth, many of them need oxygen, but there's not enough oxygen to go around, according to an Eastern Cape doctor in this news report. So again, something that's really quite simple, something that's got the difference to perhaps bring about a case fatality rate of 0.5%, could easily result in a case fatality rate 10 times higher than that, because some people just need a few days oxygen to get them over the critical phase. And if that's not available, as we saw in the disorganized, panicked situation in Iraq, if that's not available, then people can die. Now, apparently there's reports that there's been fights in the hospital of patients stealing each other's oxygen. That's reported by the City Press. Let's hope that's not true, but this is reported. And there's reports that it's a survival of the fittest situation, which of course is a comment on Darwinian evolutionary theory, where only the fittest survive. This is not something we should be seeing in modern human society. We should be well past that stage now. Let's hope that's exaggerated. But families are not allowed to enter the hospital. They're talking about severe staff shortages. And one specific instance, I can't remember when this was. This was a few days ago, good 4 or 5 days ago, I think. But 49 patients in Port Elizabeth required admission to intensive care units. 35 beds available. Now, if you're in this area of South Africa, do send me more video. Do update me if this is inaccurate. I will be back on as soon as I get that information, and I will correct the information I've given you, but that's the best information I can get at the moment from Iraq and South Africa. Difficult to get. Now, we had anticipated this, to be fair, quite a long time ago. We realised that countries with poorer health systems, less healthcare infrastructure, the proportion of patients that are quite ill or critical without appropriate medical care, which many of them are not going to get, the case fatality rate is going to increase. And as I say, it could increase from maybe 0.5% to potentially 4 or 5%. And a good few more percent on top of that could potentially die if they don't get such basic interventions as antibiotics to treat secondary bacterial infections. So there is a challenge at the moment to have oxygen supplies to everyone who needs it. Now, this is not massively high tech. Companies can do this readily. Governments can do this readily. And it's just going to be such a pity that people die through lack of oxygen. Something as basic as that. Now, in the 1918-19 pandemic, which killed 50 to 100 million people, we don't know how many, but a good proportion of those people died because there was no antibiotics for their secondary bacterial infections. And that's terrible, but the antibiotics weren't available then, so there was nothing that could be done about it. But oxygen is available now. Antibiotics are available now. And we just have this global challenge to get it to the people that need them. All they need is this support for a few days. And then they can go on and live productive lives for decades afterwards. They just need to get past this critical few days. And it seems that in these examples we've looked at, this is not happening.